Hi, everyone. Welcome to our webinar. We will get started here probably about 1 after 2. So to the 2:01, we'll give it a minute for folks to join that might be running over for some meetings. So we will get started soon. Thanks for your patience. Hey, good afternoon, everyone. We'll just give it another minute here, and then we will kick it off. So I think some folks are still rolling in. So we'll give it another minute and kick it off. Thanks. Okay. We will get started. Good afternoon, everyone, and thank you for attending our webinar today. My name is Kritesh Patel, and I'm the president of HPC, and we're excited about this webinar series that we've launched. Today, we're going to talk about school nursing as it relates to Ohio Medicaid, and we're going to touch on documentation, compliance, reimbursement, and a lot of tips and tricks. And so this is going to be very helpful for those that are either running the special education program, directors, managers, or nursing staff. Really quickly, what today will not be a demo of the tools like EduDoc or like Snap. Today will be more of an overview of the program itself as it relates to nursing and how you approach nursing in these different topics. And so if you are a customer of HPC or Snap and would like a demo and would like for us to walk you through how to use the tool, or please don't hesitate to reach out to any one of us, but we will not be covering that today specifically. um let's talk about what we will cover, though. We'll quickly talk about our monthly webinar series and what's upcoming, and then we're going to make an introduction. We are really happy to have partnered with PSNI. For those of you that don't know that company, you might probably know Snap and Bob Bundy, and so we are very excited to partner with him to talk about nursing today. And so we're going to make a quick introduction, talk about Medicaid and nursing. I know a lot of you may be a little bit exhausted of hearing about Medicaid expansion, and so we promise we will keep the nursing part, the Medicaid part, excuse me, brief, 10 minutes or so, and then we can follow up with questions after, and then we'll turn it over to Bob on the nursing specific items, which will be documentation, processing claims, best practices, compliance, and that sort of information. And then at the end, we will kind of leave our contact information up for anyone that needs it. For our next webinar series, we're going to do an LEA roundtable in March. And so, very excited about that. We're going to have Lisa Floyd join us from Cleveland Metro. We're going to have Jack Stevens join us from Mad River. And we've got a third to be announced soon, Director of Special Education, that's going to be joining us. And we're going to partner with these school districts to talk about various topics and make it really open ended for folks to be able to engage with your partners across the industry. And then you'll see some of the other webinars here. We'll be presenting at OASBO in April. One quick reminder, tomorrow, the Ohio Department of Medicaid is hosting their RMTS webinar, Random Moment Time Study, for all the special education directors. We highly, highly recommend that you attend that webinar. There are going to be some changes that happen to the program, and that's going to be from 3 to 4 p.m. This presentation today will be recorded, and we will send out the materials afterwards. So if you miss something, don't worry about feverishly taking notes. Without further ado, I'm going to introduce now our presenters today, Tracy and Bob, and I'll be bringing them on screen. So Tracy and Bob, would you like to introduce yourselves?
Okay, I unmuted myself. Can you hear me okay?
Yes, we can.
Okay, super. So my name is Bob Bundy. I am school Medicaid specialist with PSNI. And as Kritesh mentioned, our main software product is SNAP. It's a nursing electronic health record used by I think almost 100 schools and school districts in Ohio, but lots around the country and lots around the world. And my main job is trying to figure out ways to make Medicaid interesting. The jury's out on whether I'm successful on that. And I also work with companies like HPC so that our nursing users do all their charting in SNAP and their data just goes over to the billing company, eliminates all the duplicate data entry and all that sort of thing. I speak around the country on school Medicaid a lot, and you guys are to be congratulated that you're spending a Wednesday afternoon, 201 of you right now, to learn more about school Medicaid.
All right. Thanks, Bob. Tracy?
Hi, I'm Tracy Regal. I'm the Vice President at HPC. My role is to assist school districts throughout the state of Ohio to obtain Medicaid reimbursement and support everybody through the process to help maximize their reimbursement on a yearly basis as well as on interim payments.
Great. Thanks. Tracy's been doing this a long time, and so she doesn't talk about herself as much as she should. But thanks for the introductions, and we will jump right in and start with Tracy on just an overview of Medicaid and school nursing.
Thank you, Kritesh. Okay, so today we're going to talk about the expansion of Medicaid and nursing services in school Medicaid. The topics we're going to address is what type of nursing services can be reimbursed. As you may all know, is the expansion now includes all students. It is not just limited to students on an IEP. And as we go through this process, we'll identify what kind of care plans you need to utilize. We'll talk about physical health and also behavior and mental health services that are reimbursable. And also, we'll share with you the allowable activities based on the rules of what you can bill for, as well as these appropriate CPT codes that are assigned for nursing services. The first is physical health nursing services, and we have actually been billing for this since the beginning of this program. In the past, it was specifically only for students that were on IEPs. Now it'll be on an IEP or a school service care plan with an alternative approved plan that you can use. So that would be for any services. The qualified practitioners are listed here. And you can document for time spent doing an evaluation or a reevaluation to determine if a child needs this service, as well as direct treatment and therapy services for different medical nursing procedures and treatments, and health screenings. These services do need to be on a care plan, and you will need to make sure you obtain a referral or an order from a physician when you do document for these as a nurse. for LPNs and LPNs and RNs. Thank you. And then we'll talk about the behavior. This is new with the
Tracy,
expansion.
sorry to interrupt. One thing I forgot to mention is if you want to, please put your questions in the chat, and at the end of the presentation, we will try and answer all of those. And so utilize the chat feature to ask any questions. Sorry, Tracy.
That's okay. So what has been added into the new expansion is behavior and mental health services, and that would be any type of service that's related to behavior, mental health, and substance use disorder. These services do need to be on a care plan, and the examples here of what you can get reimbursed for is based on behavioral health nursing services, which would be health screenings, nursing assessments, nursing exams, and so on. These do require to have a treatment plan, an IEP or the school service care plan, as well as a referral does need to be in place for these services. There are additional services that you may not need a care plan for, which we'll talk about in a minute. As far as care plans, we'll go on to that next screen. So we have your IEP. So that there is a new Ohio School Service Plan of Care that was created by the Department of Medicaid, which allows for you to get reimbursed for Medicaid eligible services if you do not have an IEP. This is to be used by completing the first 3 pages of the care plan if you have an alternative care plan and it meets all of the requirements. So the alternative care plans that you may have, that would be the next screen, are listed here. If you do have these care plans and you do want to document from them, you do need to complete the school care plan, and that would be just the first 3 pages if they do have all the required components that Medicaid requires us to have. If they do not, you are required to fill out the entire care plan. These care plans are available on the Department of Medicaid's website, and I think Kritesh has the resources and links at the end of the presentation to share with you. And just to note that the Ohio Department of Medicaid has provided these links, and they do update them. So always try to obtain the link from Department of Medicaid so you have the most current and accurate document. So when you do use an alternative care plan, do make sure the following is in place. You do need to make sure that the services are based off being medically necessary by completing an assessment. You have students' demographic, signatures of parents and guardians, and a school representative. You need to make sure the plan has a start date and an end date, as well as the services are identified with the amount, frequency, and duration. You do need to identify what type of goal or what you're trying to accomplish with the child, as well as describing how are you going to monitor progress. You do, as a nurse, need to make sure that you reference in your plan where the prescription is for the medication, and that needs to be available on an audit. When you do these new care forms, you do need to make sure that they're filed and available for an audit if there's ever an audit. So prior to implementing this in your school district, please make sure with your school management that there's a process to maintain all of these documents so that they can be used with the agreed upon procedures, a state or federal audit. There is a new section in the rule for Medicaid for reimbursement, and it is Medicaid eligible services that you can get reimbursed for without a plan of care. This is taken from the rules. However, it's not just related to nursing. We did try to associate some of the CPT codes that are based on you as a nurse and what you can use. So what the first one would be anything that's physical, mental, or behavioral health screenings. You can now do state mandated vision and hearing screenings, and these would be the appropriate CPT codes that were identified by the Department of Medicaid that you can use for that process, as well as there's other new administration of medication, contacting the prescribing and order provider, consulting with parents regarding a physical or mental behavior condition. Those are all new, and you do not need to have a care plan, but not just because you don't have a care plan, you still need to make sure that the services that you are providing, you have documentation to prove that they are medically necessary. So while you can document this, you still need to prove medical necessity. And in all of your documentation, you have to have the appropriate notes to support what you're documenting for. Also, if you're an approved CANS assessor, you can get reimbursed for that service, as well as a lot of new interventions for tobacco intervention and substance abuse. So these would be the appropriate codes. I do want to let you know that the codes, we have worked closely with ODM to verify which codes to use and how to use the codes, but we have been working with them and they do update their code list periodically. So the information we have is as current as, I believe, 213. So next. Oh, nursing Medicaid checklist. So if you are going to bill for Medicaid, you do need to make sure that your school just as a director, you do need to make sure that you're incurring the costs for the services that are being provided by the therapist, so that you're incurring costs for the nursing services, that that provider is on your random moment time study. You need to make sure that if they are going to conduct screenings, assessments, reassessment, or any skilled physical or behavioral health treatment services, that you do have a care plan in place or the necessary documents in place. If they are doing that, they can bill. Also, as we keep reminding you, you do have to have an IEP or you have to use the school services plan of care. And then, as we mentioned, there are some services that you do not need to have the care plan for, but if you're doing those, you can then document and get reimbursed. The big thing with this is we're reaching out to all students, not just special ed. So you do need to make sure that parent consent is obtained in order to get reimbursed for a service that's being provided. I know there's a lot of questions about vision and hearing state mandated screenings. You are allowed to get reimbursed for them. However, you do have to make sure prior to doing so that you have obtained parent consent. We have kind of discussed this internally, and you can do the vision and hearing screenings for special ed because most likely your school district may already have parent consent, and we're suggesting just take it slow, do what you can to obtain the reimbursement. Also, just make sure all of your documentation is stored and maintained until an audit's adjudicated, which can be 7 years or longer. So if all of that's true and you have everything in place, then your school district is ready and prepared to bill for nursing services. Here is a list. Now, there are other nursing service areas that can get reimbursed, such as nurse practitioner, physician assistant. However, our list that we're sharing with you today are focused on registered nurse and the LPN. This list has been obtained from the Department of Medicaid. We broke it down, however, the Department of Medicaid does have an active list that they do update and make changes to periodically. And as we're working through this process, we're working to update the information that we're sharing with you. But if you are going to document, we broke this down so you could see the type of codes that we have. They have the CPT code, the description of the service, as well as the, what's really important is if you need an order, a referring order, or if there needs to be a care plan in place, telehealth. And then there are different categories. There's behavior health and physical health. You may notice that there is a code that for the LPNs, the T1003 is used twice, but what is different about that is that one is used for behavioral health and one's used for physical health. So there's different instructions on each one, but do follow this guide, because if you're going to document for a service, it's a good reference to make sure if you need a care plan for that service or not. And I will say that there has been some questions about the vision and hearing screening codes. Department of Medicaid has made that available in the expansion, and they are available for all school districts to participate and get reimbursement for that. Should you have questions or concerns about that, please feel free to contact the Department of Medicaid. But I do want to stress that that is an opportunity for school districts to jump in right away and potentially get some interim reimbursement. Okay, then we're going to go ahead and now turn it over to Bob. He's actually going to discuss more detailed of documentation for nursing.
All right. Again, everybody can hear me? Yes?
Yes.
Okay, good. Well, first, thank you all very much for having me. I talk on school Medicaid all over the country. I was in Tennessee last week at the National Superintendent's Conference, and I'll be in several states. I do have to say, for the last 13 years, I've been giving a monthly school Medicaid luncheonar series every month during the school year. And in the last 2 years, there have been a lot of people from Ohio who have joined. So I hope this is helpful information for all of you. If you do have questions, I know we'll try and answer at the end. I thought today I would share some information on 2 different areas. First one is documentation around school Medicaid, documentation to generate claims to support audits, and some best practices. And I'll say most of this information comes from questions that I get from around the country. Some of them come directly from school nurses, some come from other providers, and some come from administrators or Medicaid coordinators. And then second today, since Ohio is about to expand the state school Medicaid program, I thought I'd share some things that I've seen or learned in other expanded states that have come before you, and that might be some things for you to watch out for or watch for to take advantage of as you're moving into this in your school districts. Now, a quick disclaimer, I don't know specifics about Ohio's school Medicaid program. Tracy's information on the state plan of care documentation just a few minutes ago was new to me. And I was thinking while she's going through that, I wish other states who had already expanded had something that sort of centralized the documentation like that. It might make some of the lessons that they've learned easier for them. Okay, so I understand that I'm allowed 7 hours for this presentation, part of my presentation, and I'm excited about that. Let me get going and start with the basic information that's required in the Medicaid agency to generate a claim. Okay, and a lot of this is going to be common sense for you guys. They need to know who the patient is, and that's what they usually call somebody at the Medicaid office, not the student, but they need to know the student, they need to know the provider, the date of service, the type and the amount of service, and the diagnosis code, right, or a diagnosis. Now, one of the things that may be interesting to you guys, and maybe there's nothing about school Medicaid that's interesting, but CMS presented a couple of years ago at the National School Medicaid Conference. And one of the things that I found interesting is that CMS says they do not require a diagnosis, but all the states that I have worked with so far do require a diagnosis code. So this probably makes really good sense if you're a service provider and you're listening today, a school nurse or an SLP or a PT, of course, this is what it takes to generate a claim. Who's the patient, what I do for them, and when did I do it, right? Okay. You're probably generating all of that information in just your core service documentation. However, that is not all the documentation that your school district needs to have on hand to support claiming activities when your files are reviewed or when they're audited. And so I want to go through that real quickly. And some of this Tracy covered kind of at a high level. I'll dive into it a little bit deeper for both the traditional Medicaid with IEP-based services and expanded school Medicaid. So the first thing that your district has to have on file is the authorizing documentation. Basically, what documentation says that this reimbursable service needs to be delivered to this student and then submitted to Medicaid for reimbursement, right? Well, if it's a service that's covered by IDEA, like you have up to this point, you obviously have to have the IEP, and it obviously has to be signed by the appropriate people. Auditors typically want to see the most recent evaluation, whether it's the initial or the reevaluation, and that it clearly indicates the need for this reimbursable service. You know, you can't just slap individual speech therapy on an IEP with nothing in the evaluation that supports the need for the service. Now, next thing that I've got here is physician authorization. And I don't know if Ohio requires physician authorization on any services. Some states don't require it at all. The IEP is enough. In other states, physician authorization is required for the therapies, PT, OT, speech language. And in some other states, every service requires physician authorization. Now, that's if your reimbursable services are covered by IDEA. What about the new expansion-based services, right? There's no IEP involved. This child is not receiving any services under special education. So what's the authorization for this? Well, Tracy's slide earlier indicated the Ohio plan of care, and then any of those other types of plans, asthma plan, diabetic plan, those sorts of plans that would be attached to it. Okay. And again, this looks to me like it's brand new for Ohio, and collecting that information on students who don't have IEPs, that may be a challenge for some of your school districts. And one of the things I'll talk about near the end, as far as some things to watch out for, is investigating your own processes, which have been built around special education and school Medicaid for probably 25 or 30 years. Okay. After the authorization, auditors want to see the parental consent. And again, Tracy mentioned this. Consent must be in place the day the service was delivered, not the consent that's in place the day of the audit. And years ago, consent was sort of ignored because Medicaid auditors or Medicaid file reviewers, they looked at the Medicaid side of things. IDEA and FERPA, which control the consent regulations, those are under the control of the Department of Education. And so, you know, probably even 5 years ago, Medicaid auditors around the country really didn't pay much attention to the consent stuff, but it doesn't get missed today. Auditors are specifically looking for the consent, and they want to make sure that the consent was in place the day the service was delivered. Okay. The next one is the proof of delivery. They want to see when they walk in that you can prove at the school district level that the service was actually delivered. We've already seen the majority of this stuff. It's the stuff that I showed you right at the very beginning, right? But the auditors want to see two other very important pieces of information. First is the clinical note that describes the encounter with the student and the provider's signature, usually either electronic or manual. I don't know of states anymore that don't take electronic signature. Texas was the last one that I was aware of, probably about 5 or 6 years ago. The clinical note, what happened in the encounter? This is where I get a lot of questions from around the country, from service providers, school nurses, PTs, OTs. And I get two versions of the same question. One, well, in the clinical note, what should I write? What does Medicaid want? And the second version is, I wrote something. Is this good enough? Will this do? And, you know, they're asking those questions in relation to Medicaid billing. Is what I wrote good enough to pass an audit? And so my opinion has always been, I'm not an auditor. I can't tell you in any specific state, in any specific situation where I haven't seen the IEP and I haven't seen any of the other paperwork, to tell you whether that clinical note, that your description of what happened in that 35-minute session is good enough. I will say for school nurses, PTs, OTs, other service providers, you might have different levels of confidence depending on what tools you have for your documentation. Some providers around the country are still documenting on paper log sheets. Others are using software that might give like a big text box, like the one I've got shown up here on the screen. And others of you might have software that steps you through the documentation elements. Okay. It could be something like your Medicaid billing software. And I know that there are lots of people on the conference call today from who work with lots of different companies. It might be an EHR like a SNAP or something, or it might be some other system. Maybe there's a module in your special education system that tracks these things. You might have a different level of confidence depending on what kind of tools you have. So I want to give you a couple of examples. Okay, and I'm going to start with school nurses and school Medicaid. As far as your encounter notes, I don't really worry that much about your documentation. One, it's part of your license. Two, it's part of your daily practice. Every nurse I know, I think they have it tattooed on their forearm. If it wasn't documented, it wasn't done, right? And so what I've got up here is an example of some nursing documentation. So here at PSNI, we have 4 RNs on staff who work with all of our customers. And I asked one of them to give me a sample encounter. And she just happened to pick a bloody nose. And I just said, just pick a sample encounter, do the documentation. I just would like to see it. Now, she used a template, which really streamlines the documentation, and it's a standard feature of most EHRs. And of course, the template is a starting point for a nurse, right? They could add more stuff to it, or they could remove things that weren't actually applicable. The items on the left on this screen are from the template, and the items on the right contain any notes that the nurse felt she needed to add to what went on in the encounter. So I don't worry a whole lot about nursing encounter documentation from a Medicaid standpoint. Remember, and Tracy was just saying, if you're documenting some of these expanded services that don't have a plan that are associated with them, you need to be very detailed in what happened. You need to be detailed in what happened in any of your encounters, okay? So I'd like to just share a couple of other examples with you, because HPC did say that there could be people participating today who are not school nurses, maybe special ed directors or Medicaid coordinators or something like this. And so this is a session note from an example session note from an SLP for an individual speech session. And if I saw this in any state around the country, it wouldn't surprise me, right? It seems complete. Again, I'm not an auditor, but it tells me what's going on in this session. Some SLPs might document more than this, or they might document less than this, but this would be typical. If somebody showed me this and said this was a session note or a clinical note from a speech session, I'd say, yeah, it looks pretty typical to me, right? The types of session notes that do give me heartburn are things like this one. And I've seen plenty of these, and I'm sure auditors in Ohio and other states have seen lots of these as well. This just isn't going to cut it. Again, this was an individual speech session, the W sound. We worked on the W sound today. That's probably not going, that's going to get flagged in some sort of an audit. So I do have some guidelines, because I can't tell you what to put in your documentation, right? And you wouldn't want me to anyway. But these are some guidelines that I give the providers when they're asking me these kinds of questions, okay? Make sure that you have a narrative description. What actually happened in the encounter? Why did those activities in the encounter occur? How did the student respond to the activities? And was there any indication of progress or achievement or an outcome? Okay. If you don't have anything else as a framework, what I would say is to use the SOAP note framework, which I know all the nurses, of course, would be very familiar with. And a couple of other things that I've got here. Make sure the note matches the reimbursable service. Don't be typing details about a headache in this encounter if the service that you're submitting for claiming is a vision screening. Make sure that your documentation supports the number of units. If you say that this was a vision screening, but you say this encounter took 5 hours, your note better explain in very, very great detail why that happened. And then the last one, and again, this kind of goes back to what Tracy was talking about, tie it back to a plan where it's applicable. Okay. There again, she gave a couple of examples where there may be services that are reimbursable under the expansion where there's no plan actually there. But if you are documenting to a plan, make sure that you tie it to a plan in your documentation. Okay. All right, so we have the authorization, we have the parental consent, we have the proof of delivery. Those are the documents that auditors will look at for sure, 100% sure that they're going to look at that. Well, there are other ones that your school system needs to have in place that you may not consider that auditors don't always ask for, but they always can ask for. Attendance records to documenting that the student was in school the day the service was delivered. And again, some of you may attend the National School Medicaid Conference. This last year, CMS did not come. I think the government was shut down or something like that. But in previous years, they've probably been there for the previous 10 years. And the thing they say consistently year after year is the number one audit finding that they see is that school districts cannot prove with attendance records that students were in school the day that a reimbursable service was delivered. Okay. They may ask for payroll records. Was the provider actually in school that day? If it's an agency nurse or something like that, they may want to see timesheets and the invoice from the agency whose nurse was working that day. And then they can almost, yeah, they don't always ask, but they always should. The license or the certifications that were in place the date of the service, not the day of the audit. So in the state of Arizona, bus drivers must have, to be reimbursed for transportation services, bus drivers must have a valid first aid certification and a valid CPR certification. And those are things that typically the Medicaid agency wouldn't keep on file. They wouldn't deny a claim for something like that. So you better believe it's got to be at the school district when the auditors come, and they don't want to see today. They want to see, as Tracy said, 7 years back. You could be audited 5 years back, and let's see the certificate for CPR for that bus driver on that date. Was it in force? All right, now turning to nobody's favorite topic, and that is medical codes. And there are two types of medical codes. There are procedure codes and there are diagnosis codes. I'll talk about both of them just a little bit here. Procedure codes describe what you did for the student. Okay, as part of the CPT code set, there are about 11,000 CPT codes out there, and they define just everything, brain surgery and catheterizations and I mean all this kind of stuff. What you did has a CPT code. Now, no matter what kind of a service provider you might be, nurse or PT, OT, something like that, there are undoubtedly many more CPT codes that you could provide, that your license would likely allow you to provide, that you do provide. However, school Medicaid will only reimburse for a limited set, and it's that way in every single state. These are some of the typical ones that I know are used today. And then Tracy showed you the spreadsheets of RN and LPN services that will be reimbursable moving forward. But the Medicaid agency and the school Medicaid program limit which ones will be reimbursed. It doesn't mean they're limiting which services you can provide. It's limiting which ones will be reimbursed. Okay. Now, the other ones are diagnosis codes, and the diagnosis codes say why you provided service to this student. There are more than 70,000 diagnosis codes out there. And again, I don't know, and the ones that are up on the screen are valid ICD-9 or ICD-10 codes. When they went from ICD-9 to ICD-10, they just kind of expanded and blew it up and just added a ton of different codes. There are more than 70,000 of them. Some states, and I don't know Ohio, some states only use one. The state of Washington uses one diagnosis code for all school Medicaid services. Some states have limits. So the state of Pennsylvania, which is actually a commonwealth, not a state, I believe they have a range of about 20 diagnosis codes that that nurses can use, or school providers in general. And in most states, all the diagnosis codes are available. Okay. When I talk, this is probably the number one area that I have conversations with school nurses around the country, especially if you're in a state that allows you to pick from any of the 70,000 diagnosis codes. I get two questions about this. First one is, Bob, why do I pick a diagnosis code? Doctors diagnose. I am not a doctor. I should not be picking a diagnosis code. And what I tell them is, you're not diagnosing the student. You are using a certain code set called the diagnosis code set, but you're using a code set to pick something that you believe describes why you're providing service to this student. Okay, a student walks in, fell on the playground, arm is sore and red and swollen, and maybe you pick the diagnosis code of a sprained wrist or something like that. You're treating this child for a sprained wrist. Okay. I will undoubtedly get the second question immediately after. What if I picked the wrong one? What if it was broken? What do I do then? Well, what I tell people is, you picked a code based on what you saw, what you observed, what the student said, the equipment that you had. If you pick a diagnosis code that you believe explains why you are providing service to the student, you will not be wrong. Later on, if that student's parents took him to urgent care and there was a fracture, you didn't have an x-ray machine. The student wasn't experiencing a lot of pain. It was swollen, but you picked a code that matched what was presented to you. Okay. So let me move on to a few best practices that, again, I share based on people that I've talked to. One of the things that I don't think it was in my biography, but I was the president of a billing company for 5 years, did not compete against HPC in a much different part of the country. And so, we saw lots of findings from audits and lots of questions back and forth with state departments, Medicaid agencies. So best practices: do use standard abbreviations. Yes, by all means you should. Do use standard terminology. Yes. Do not use special marks. And the example I give is a school district where their staff, if they wrote, it was something along the lines of 3 ampersands, meant the student didn't show up today, or something like that. 3 ampersands, they all knew what it meant. Medicaid auditor didn't know what it meant. And the thing that I tell folks is, Medicaid auditors, you're probably not going to be their first audit. You may be their first school audit. They may have audited lots of other places before, for Medicaid or for other purposes, but you might be their very first school audit. And so do not use special marks that mean something just to your staff. Do your documentation timely. Again, for the school nurses listening today, I don't worry about you. Very, very few nurses that I know would walk out the door at the end of the day without their charting being complete. Some would, and it does happen. But generally speaking, they're going to finish their documentation. I have worked with providers, let's say a physical therapist, who did all their documentation for Medicaid billing at the end of the month, the last day of the month. And that's just not a good practice. Okay? Be very consistent. Document the same way for every encounter that you have. A lot of times people will, over the years, have said, well, if they have Medicaid, I should do this. I said, no, be very consistent with what you're doing. If you document this way, whether they have Medicaid or not, document that way for everybody. Okay. Be consistent in the terminology you use. Be consistent in your overall documentation. Yes, you can use standard terminology and standard abbreviations, but make it understandable. I think a good rule of thumb, and of course you may all disagree with me, and that's fine. A good rule of thumb that I've always thought was fine was making it understandable if the parents of this child read your note, what went on. Again, Medicaid auditors, you're not their first rodeo. You might be their first school rodeo as well. So just make it understandable to them. Okay. Last one is do not think Medicaid. So I've been here at PSNI supporting school nurses for about 6.5 years. And in the first probably 2 or 3 weeks that I was here, had a phone call from a nurse and she said, Bob, we're in a state that has 15-minute units. Yeah, well, fine, fine. She says, do we round up I think if it's 8 minutes, we round up to 15. If it's 7 minutes, we don't. If it's 7 minutes, should I even document this? And one of the things that I told her, which I have told people for 20 years, is do not think Medicaid. Do not worry whether they have consent or not. Do not worry whether or not they're enrolled in Medicaid or not. Okay. You should not be documenting any differently for students for Medicaid purposes versus non-Medicaid purposes. And I will say one thing just real quickly. There's not a lot of fraud in the school Medicaid world. There are just way too many people involved. One of the ways that fraud happens in the private sector is it's one person late at night doing certain billing things and all that kind of stuff. It's easier there. In the school world, with your billing company and your providers and your administrators, it's really hard to have a Medicaid fraud. But auditors think that way, right? And one of the triggers for a Medicaid auditor is if they hear that something happened in my documentation because I knew this child or patient was enrolled in Medicaid that I don't do over here, that's a red flag for them because they are thinking, not so much in the schools, but they are thinking in their Medicaid audits, oh, somebody could be gaming the system. So it's best if you stay consistent. If you don't think Medicaid, you just keep on going the same way consistently for everybody. All right, I'm getting close to the end, and I know you're all applauding that, and I can't blame you for that. I want to just share a couple of things that I have seen from states that have expanded. And there are, well, I'll show you a map in just a second. There are a lot of states that have expanded services. Some of them have done it the way Ohio has, and others have done it a little bit differently. When Congress creates a new program, something like IDEA or the TSA after COVID kind of stuff, or I mean, after 9/11, they have legislation that's hundreds or thousands of pages long, right? This paragraph is the language that Congress used to author school Medicaid. One paragraph from, almost 40 years ago. Okay. And you don't have to read the whole thing, but what it basically does here is it ties school Medicaid reimbursement to services in IEPs or IFSPs if it's a Part C child. Okay. So that was very clearly defined. And when school Medicaid programs were created by states, including Ohio, they tied reimbursement to services on IEPs. And CMS came along a few years later, 9 years later, with the free care guidance. And free care basically said, and if you guys attended HPC's free care webinar, you probably went through this. But it basically said, if you're providing a service free of charge to any student, you cannot provide that same service to a kid enrolled in Medicaid and get Medicaid to pay for it. Okay. So it's called free care because if you're doing free care, you can't bill Medicaid. And you think about it, we've got 2 students and they both have speech therapy. They both go to the speech therapist for the same service. One kid's enrolled in Medicaid, another kid gets health care through their parents' insurance at work, something like that. The school district is not billing the insurance on the parents' side. So Medicaid, and what CMS said was, well, then you can't bill Medicaid. Well, in 2014, that's when they withdrew that guidance. Okay, so it's been 12 years now since they withdrew it, almost exactly 12 years ago. It was in March of 2014. Okay, these are the states in dark blue that have expanded in some way. Okay, like Ohio, so there are two ways to get your program expanded. One is what's called a state plan amendment, which I'm sure you're aware of. The state of Ohio Medicaid agency would write up a plan amendment that says, hey, we want to change our school Medicaid program this way, and they send it into CMS. CMS reviews it and ultimately will approve it. Okay. The other way is that a state might be able to expand, and by expansion, that means reimburse for services that are not on IEPs. Right? They may be able to do that within the framework of their existing school Medicaid program. So in the state of Washington, for example, Washington worked with their managed care organization to include some additional services to be reimbursed to schools because they worked with MCOs in Washington, which meant they didn't need to file a state plan amendment, but they didn't also expand their program as much as Ohio is going to expand their program as well. Okay, it took probably 3 or 4 years before any state got brave enough to try this. Louisiana has done it twice, and they're in the middle of their third state plan amendment to expand. And there's some states on here that will probably never expand. They'll just always reimburse for services on IEPs. Okay. Nursing and mental health are the two services that are the most impacted. Nurses provide services to all kids. We have a student with type 1 diabetes, does not have an IEP, is working at grade level. The type 1 has no bearing on their educational achievement. It's just they might have an individual healthcare plan to manage that diabetes, right? So you're providing more services to more students. That means more reimbursable services. One of the things that requires is that nurses start having to, again, I don't know Ohio, so this may have been taken care of, but in many expanded states, the nurses all of a sudden have to start dealing with those diagnosis codes at a much greater level because they have to pick the diagnosis code that meets why that student walked through the door. Okay. Again, in some states, hopefully not in Ohio, the staff will be documenting their IEP-based services. You know, think about it. If you were documenting it as a service provider in your school district, if you're documenting your services for Medicaid in the IEP system, which some school districts around the country do, because your IEP system can bundle up records and send it to HPC or any of your billing companies out there. Your IEP system is built for kids who have an IEP. What about kids who don't have an IEP? Where are you going to document that sort of thing? Probably not in your IEP system. And so it ends up, I shouldn't have probably said double documentation, but it's not unknown where especially school nurses or mental health providers, counselors are documenting their IEP-based services over here, and they're documenting some services over here. Okay, I think it's the last slide. Some gotchas. What goes on when a state expands their school Medicaid program? Consent. Consent is a big hangup because special education has been managing consent around school Medicaid for decades. They've got forms, they've got it in their packet. They know every time they have a meeting with the parents, they're going to bring it up at such and such a time. They know all of that stuff. Now we're talking about students who don't have anything to do with the special education department. Who's going to grant consent? Who's going to have the discussion with parents? Who's going to store the consents? If I am a school nurse, is it my responsibility to get consent for reimbursement of the services I provide? Well, that student also has seen a social worker and for some reimbursable services. Do I need to coordinate with the social worker or vice versa kind of thing? This is probably, since the day expansion happened, this is probably the top area that I have told school districts to look out for. Okay, not that special education doesn't want to help, not that they won't help. They've got their own processes built around their own services. So what's going to happen when your files are audited? Who's going to have that consent discussion with the parents? And the second thing here is getting your processes in order. I can't stress enough how many school districts are not taking advantage of expanded services because they don't have their processes figured out. So not last summer, the summer before, I was a keynote speaker at the Arizona School Medicaid Conference in Phoenix, and there were 100 school districts represented. And I asked them to raise their hand if they were billing for the expanded services. And Arizona had been expanded for 4 years. 5 districts out of 100 were billing for the expanded services, and everybody else was not. And we go around the room and ask, why not? Well, we haven't gotten guidance from the state. We haven't gotten the model forms. We don't have the processes in place. We don't have our consent process. Special ed isn't going to help us with this anymore. And so today, I just asked about that. 19 school districts in Arizona, so still less than 20% are billing for expanded services. That's been 6 years now, and that's money they're leaving on the table. And again, their number one issue is failing an audit. Okay, and if they don't have the processes, and if they don't have forms to put into their processes, if the expanded services encompass nursing and counseling and social work, and those 3 departments are not in alignment, makes it really, really scary, I would guess, for a school district to go into billing for these services, knowing that you're going to have to scramble when you're audited to find the right records, and knowing what happens if you can't. Okay, so it's coming in Ohio, and the number one thing I would recommend for everybody listening, even the HPC people, is work on the processes. If there are people on here from the state agencies, either DOE or the Medicaid agency, my experience tells me that your constituent school districts will be very hesitant to move forward unless they get very clear guidance. And again, that's guidance they've had from the special ed department in the Department of Education for the last 30 years on the IEP-based services. Okay. Last thing that I had here is very similar conceptually to the checklist that Tracy had. Was one of her last slides. This is a checklist that I put together years ago for a customer, and I just took a screenshot because it's a good example. Before billing services for a student for the first time, do you have everything you need? You know, whether it's a special education or a student receiving special ed services, and these are going to be billed because they're on her IEP, or if it's a student who has no IEP, do we have everything we need? Do we have the consent? Does our physical therapist have the right license? Does our school nurse have the right license? Do we have this? Do we have this? Okay. Until we can say yes to everything, do not bill. And then the last one is something that I've recommended to customers for a very long time, and that is conducting a self-audit. And so the checklist on the right is sort of a self-audit checklist, going through and saying, you know, we were just paid for these 5 services, and do we have everything that we need? And you should know everything that you need, right? You know that you need the consent, and you need the IEP, or you need the evaluation, and you know all those kind of things. Do you have them in place? And you know, I've said this to customers for years. If your school district brings in $50,000 from the school Medicaid program, money that's going towards either positions or programs or equipment or something like that for your kids, you know, is it worth 2 or 3 hours, maybe every quarter, to evaluate your own program and make sure that you have everything in place? Because it's a lot better if you find it, fix it, put it in place, than it is if an auditor finds it, and it's been something that's been going on for 3 or 4 years, and they go back in and recoup a lot of money. Okay. I'm happy to send any of these kind of tools to anybody if you want. Some of these are a little outdated because and they were built for other states, but I'm happy to send them as examples if anybody's interested. So that was it. That's all I have. 39 minutes, 32 seconds. And thank you all very much for having me. Kritesh, I'm gonna let you handle the questions.
Bob did not tell us that he was going to call Tracy out like that and get her to answer the hard questions. There are a lot of questions in the chat. So assuming Bob, well, if you have time, maybe we'll stay on here to see what we can get answered. And for those questions that we can't get answered, we will do our very best to send out an FAQ or just reach out directly to us. Bob, if you just want to go to the next slide where you've got your email address and Tracy's email address. Sorry in advance to both of you if your inboxes start blowing up. But there are other emails that you can email at either SNAP or HPC. But I'm going to start with a couple of quick questions that I can answer. And then Bob and Tracy are a lot smarter than I am. And so I just kind of wanted to be able to answer a question to say I did it on a webinar. So one person asked if their district is still using paper and pen, can they bill? And about 30% of school districts in Ohio still document paper and pen. The question is technically yes. However, I would highly recommend moving over to electronic documentation for all the things that Bob and Tracy talked about today as it relates to audits and compliance and efficiency. So please reach out to us directly if anyone is still doing that, and we'd love to kind of help you there. And then the next one I'll ask is there's a lot of questions around examples of how folks handle parent consent at the school districts and that sort of thing. If you reach out to us directly, we can give you some tips on how other districts do it. In 3 weeks, we're hosting that LEA roundtable where other school districts across Ohio, like Cleveland, like Mad River, like a few others, are going to be talking about how they handle parent consent, how their processes are that Bob just mentioned, right? Like you can ask them those questions, you can ask us those questions. We'll be able to answer those for you. And there are some schools that have already implemented Medicaid expansion. And I'm going to, so we can point you to maybe those folks that can help implement some of this at your school district. Can I get more information on SNAP? Yes, you can. You've got to reach out to Bob. And there's his email there. So message him there. But I'm going to start going. That's all I can answer, Bob and Tracy. That's about all I've got. So I'm going to go and start putting some questions for you. How do we know if the student has Medicaid? I have no knowledge of my student's insurance status. Tracy, you want to take that one?
Well, it's not up to you as the professional provider to worry about if someone is Medicaid eligible or not. What happens is you document for your services, and your billing vendor will work with obtaining the Medicaid eligibility on students. They do go on and off Medicaid frequently. So as what we do and what's been asked of the billing vendors in Ohio, we don't share the Medicaid status with anyone. We do that on our side of things. You document, we then check, and then we'll send them if they're Medicaid eligible. So you don't have to worry about that.
Sounds good. I'm just picking some at random. Does all of what we covered today apply to school-based mental health providers too? We have some services provided solely through a third party, but we share some employees as well. Do our third-party providers bill Medicaid? That's a question that you're going to have to ask them. And then what about our shared social worker?
Well, all school districts have, so social workers, there are many. Today's session was related to nursing. However, part of the expansion, there is expansion and additional service providers that can document social work, licensed clinical counselors. There's also Cheryl, can you jump in? I can't remember the list, but there's other types of mental health providers that can get reimbursed. You can get reimbursed, but the school district has to be incurring the cost of those services, and you have to make sure they're on your random moment time study. So you can do that, but related to sharing costs and third parties, that's more of another conversation that requires us to ask more questions. But I do want to say one thing, Kritesh. I do notice there's a theme about parent consent. Parent consent is a one-time life consent that must be obtained by the school district to allow for your school district to share data and bill for Medicaid. It is not related to the parent consent to test. So it is a parent consent process that must be maintained at the school district and is a one-time life consent. However, the school districts must also send out an annual notification informing all of the parents and guardians of their rights with parent consent. That just seemed to be a big question. And through all of this process, there's a lot of questions about procedures. I think as Kritesh said, there's a lot of ideas out there, and we are hosting the March roundtable, which you'll be able to hear from other school districts and what they've been doing to get some of this started.
But if you can't wait until then just reach out to us and we can
Oh,
share, what other folks have been. Okay, Bob, this might be a tough one. I'm not sure, but it is a SNAP question. So how would vision and hearing be entered if billing is done through SNAP? So billing is not done through SNAP. Billing is done through HPC, but the documentation would be done in SNAP if you use it, I believe. Bob, the question said it requires a doctor's name and license number in that order.
Yeah, so again, different states, different requirements. And for those of you, because I saw in the chat a couple things too, SNAP is an electronic health record. It's not a billing software. This is where school nurses, mental health people document their services, and the services are extracted and sent to in HPC or whoever the billing company is. So just make sure that everybody's clear on that. SNAP does allow billing for screenings. And again, it depends on the state. I just wrote up the documentation the other night for screenings on Arizona. I'd have to look at Ohio to see how it's documented. But, if you're documenting all your screenings, vision, hearing, any of the other ones, that data can be extracted and sent to the billing company.
Just to note that there are some services that you do not need to have a referral, and vision and hearing is not required. Direct treatment and therapy, care plans for children would need a referral for an approved Medicaid provider, which could be the physician assistant, nurse practitioner, and that information in our system, you put that information in our system. And I think, Bob, you guys collect it too in SNAP, right? The NPI number and the doctor's information. Yeah.
We do. Yep.
Mhm.
Can I just jump in here real quick? I just want to make it really clear to HPC clients, just because you may be using SNAP, you want to confirm with your special ed department that you have an agreement with SNAP. The district has an agreement with SNAP to download that billing information to us. Not every district using SNAP is
Good point.
taking advantage of that. So I just don't want nurses to be confused.
That's a good point. Thank you, Cheryl.
There's a lot of questions on vision hearing. Tracy, there's one that says for the vision hearing, for vision hearing billing, every student needs 3 to 6 pages completed. I'm assuming for the care plan is what.
No, there's no care for the vision. There's a section in the new rules that allow you to get reimbursed for services that do not require a care plan. And vision and hearing do not require a care plan to be created or a referral. So those are services that you can document, but just because when you document, you do have to make sure you have the results documented and all the supporting documentation as far as the service you provided. The issue that you would have to make sure is in place for you document, and then for the school to get reimbursed for interim reimbursement, parent consent must be obtained for that child for us to send it in for reimbursement. But you do not need a care plan for that or a referral from a physician.
Okay. Let me keep going down. During an audit, if ODM feels that the documentation is not enough, could they require being reimbursed by the district for services they already compensated if the documentation is not sufficient? So basically a recoupment.
So there's different types of audits. So that's I specifically, there's the annual audit that's done with the cost report. It's called agreed upon procedure. There's certain guidelines that have to be followed and reviewed. If there is found that the school district did not have attendance records or parent consent, the school district does get adjusted for that one amount. The state and federal audits, Bob, you could speak to that, or if, I mean, I don't know. I think that they may have different criteria when they audit or what they're reviewing. I think it depends on what the audit is related to. So Bob, do you have a better response to that?
Yeah, I mean, if it was a state audit, again, it depends on the state. They could require repayment. I have seen audits where, where they're auditing 20 different services and 2 services have a problem and they ask for the money for those 2 services back. I've also seen where 2 services have a problem, so they open up the audit and they find that that's a prevailing product or a problem, for all of those services, whatever they are. And they go back and they ask for substantial amounts of money back. On a federal audit, if OIG came in to the state, they would be auditing at a high level. And, any findings they had would be directed to ODM. They would say, ODM, these were the problems, you owe us this money back. They would not go down to the school district level generally, but ODM certainly could. Texas last year had a massive finding that they fought it for like 4 or 5 years and ultimately they lost. And so they finally went to the different school districts and said, school district, you owe us this money back because this is what OIG found at the state level.
And I guess the bottom line is that what we're sharing with you is what's required, and all school districts need to make sure that they have what is required. You do need to make sure there's medical necessity, test results, documentation. All this documentation must be maintained and stored in the event of an audit. So that's why we do ask that school district managements collaborate and come up with a process before every different service areas start adding new documentation into the process. And I do want to comment, I see something that says that somebody received documentation that visual acuity does not require an IEP or care plan, but 92551 does. So I will let you know that Ohio Department of Medicaid does have their CPT code list where they do update that periodically. You do need to make sure when you click into that document that you are looking at the browser version. We had noticed that if you pull it up through Google, it's not the most current, it's a downloaded document and you can edit it. And also I will tell you that we received confirmation directly from the Department of Medicaid via email on the process as far as also verbal communication, and whether or not they updated that information yet on their side, I cannot speak to that, but I do know that in fact that is accurate, and I did get a verbal confirmation on that today as well.
Kritesh, I apologize, but I have to leave.
Oh, no.
Thank you, Bob. Thanks for your time.
Thank you. Thanks for staying over, Bob, and thanks for the presentation.
Yeah, and
we are over time, so if you guys want to continue questions.
Yeah, if there are any
we'll
hard questions for me, just pass them along to Tracy if you wouldn't mind.
Yeah.
Okay. Thank you.
Yeah, thank you, Bob. Thank you, Bob. That was great, and I think we can stay on maybe for a little bit, Tracy. I will share the title of our presentation so everyone doesn't have to look at zoomed in pictures of our faces on here. Let's see. Here we go. Okay. Or you're sharing. Someone's sharing.
Can I just make a really quick statement for anyone that's on there? Nursing services have always been part of the school Medicaid reimbursement process when they were associated with students just on the IEP. But this expansion has really allowed for nurses and behavioral health to actually tap in, because we're now capturing all students. And there are opportunities for nurses to start documenting without making sure we have specific care plans and referrals in place. And this is the example of what that would be. However, you do need to make sure that your school district is obtaining the one-time life incentive to actually send in for Medicaid. But it is a benefit to the school district. If nurses have not been billing in the past, it's an opportunity for those nurses to start documenting. That would increase their allowable cost overall and their interim on a monthly basis.
It looks like someone from the Ohio Department of Medicaid commented, make sure you clear your history and cache when accessing the code set, just to make sure. Tracy, so someone asked, do we have verbiage to use for one-time consent? Yes, we do. We can go ahead, Tracy.
It was there was the PR 10 form that was used in the past. However, we do need to make sure it does not only specify for students for IDEA, IEP. It's for all students now. So we do have something that we can share with you if you reach out to us.
If you screen for 1,000 kids in your district for general screens, you go in and input each one for all 1,000 students?
Well, in order to get reimbursed, you need to make sure you follow the guidelines. We do need to have the student's name, the start and end time, the appropriate codes need to be selected. So yes, information is required and you do need to do that, but it's all based on how you are. If you're using SNAP, I think they have a process in place. You just document that. And if you, and also just so you know, it's not, HPC is working to integrate with other platforms as well. It's not just SNAP, but that is the biggest one that we're working with for nursing. But in order to get reimbursed, the documentation does need to be done. So I don't know if it's looking at all 1,000 of them at first, but I think it's based on school district, but you do have to provide the documentation by entering it in some sort of billing documentation system or platform for
So
documentation.
if a student leaves the district, Tracy, and comes back, in terms of the consent, do they need to get it again, or is
They
the
do,
one time
because
okay?
yeah, because they left and they're coming back, circumstances may have changed. They must obtain it again to make sure.
Okay. Do you use data from PowerSchool? We do. If we can get it in the right format, and so reach out directly to me. Again, I'll put my email in the chat. We will send Snap. I'm a little biased because they are a really great partner of ours, but we integrate with everybody that wants to integrate with us. And so some of these companies won't listen to us. We do integrate with School Care too. They will listen to you. So what we do is we will send you the file, and Infinite Campus too. So what we will do is we will send you the file that's required information that we need to be able to import it. You would then contact your representatives at each one of these companies. You can copy us on the email and say, hey, we need the data in this manner populated so that we can submit claims for Medicaid billing. And they are required to do that. It is your data. So they are required to provide that to you. And then you would send that to us, and we would set up a process where you would send that to us, and we would continue submitting your claims for billing, and your providers only have to document in one system. So again, reach out directly to me on these special cases. Snap has just made it easier for us because we work directly with them on your behalf. Some of these organizations, I can't say that we're allowed to do the same.
And please, this is related, the questions that we're responding to currently about integration is related to HPC. If you're using a different vendor, you need to contact them if they're able to do integration. Kritesh's response is only related to the people who do currently use HPC. And we work directly with the platforms to set up the integration in the school districts.
Or contact us. Up to you. What would reimbursement look like for screening? So those amounts, Tracy, they are shared in the CPT code tracker, right? The reimbursable amounts.
Right, but when we look at this, there's different ways. You're asking if you're a nursing, what there is, the CPT codes do have a rate of reimbursement, but you have to keep in mind that reimbursement is based on whether or not the child is Medicaid eligible or not. The school district gets what from documentation, an interim payment, but overall it also has it's a cost reimbursement model. So what that means is you're adding nurses, so you get to add their salary and benefits to the overall cost of your program. Documentation is done on a monthly basis. School districts get interim payment, but there is a process where the school districts settle up on the cost report based on salary and benefits minus the interim amount. So there's no, I mean, you could look at what the rate is, but that's not going to help you because the cost is, there's more to the cost process. So if you have specific questions on that, reach out to us. We can help you decide how that would look in your each individual school district by adding nurses to your program.
Can we share the link for the PR10 form for proper verbiage to the group? Yes, we can. Megan, if you just reach out, I'm trying to field through all these questions. So if you just reach out to me directly, and then I will be able to share that link with you. Where can I'm new this information, and where would I get this information from? Again, just reach out to me. I will put my email in the chat, and I can help direct you to answer any of these questions. Do you need a SSCP for universal screenings? I don't know that acronym, but you might. I don't know.
So with the screenings, I apologize. I don't know what the acronym is. For the state mandated screenings, as long as your nurse, are providing the service within the scope of their practice, you receive parent consent, and the information is documented in the system, you can actually obtain reimbursement. I think that acronym I'm not familiar with.
Summary
I
of
think they might mean
safety.
the school services plan of care.
Oh,
Oh,
I didn't even put that together.
school
Thank you.
services care plan.
No.
Got it.
No.
Yes, sounds like that is. Okay.
I was
Maybe
thinking
a
it was
few
like
more
some other
minutes.
credential.
I'm trying to look through
Can I just,
to
can
see.
I jump
Yes.
back in for a sec?
Chime on in.
I just want to circle back to the question about codes and time. So some codes are encounter codes, some codes are timed codes. The majority of the evaluation services are not timed codes, so there is not a minimum amount of time required. If you are documenting for a treatment service, for instance, that's different. And that is a timed code. And over the course of the day, you need at least 8 minutes of service with that student. It can be in multiple chunks, 2 minutes here, 5 minutes here, 3 minutes there. You've exceeded 8 minutes, document all 3 services to meet that 8-minute requirement. But that's for treatment, not for the state mandated vision and hearing screenings or vision and hearing screenings for a plan of care.
And again, on the CPT codes that are provided by the Department of Medicaid and the information we have here, it does have within the description if it's a minute code or an encounter code. So if it does not have the minutes, it is considered an encounter code. So that's not based on minutes.
Right. I think I already answered, I think not you, but let's see. Is there any way to know how much a district would get reimbursed for each service or student? For instance, if the district gets consent for students and submits for reimbursement of the mandated vision and hearing screening, what is the per child reimbursement? I think you answered that one, right, Tracy?
So every school district has a Medicaid eligibility rate. Not every child is Medicaid eligible. When you do your documentation, it's up to the billing vendor to determine who's Medicaid eligible. There is an appropriate fee for each service. And if they are Medicaid eligible, the school district will get reimbursed for that service. But that's not the end of the reimbursement process. It's also related to cost reimbursement. That's the amount it's costing to add a nurse with their salary and benefits or contracted costs. I can get real quick if you just want the rate of reimbursement. And the rate of reimbursement is the fee that's assigned, but that does not mean that's what you get reimbursed, because the school districts have a 60-40 match or whatever the federal participation rate is. So the rate the way they have it is not really what you get reimbursed. Let me check what that is. If you continue, I'll look for touch to see what that is.
Yeah, go ahead. I'll just go to some other questions.
If you need more information to like focus on adding nurses to get reimbursement, I think that's a good conversation to have with us because we could help work it through. It's not specific to the service. There's more to that actual process.
Yes. And just a point of clarification, expansion wasn't the reason why. I mean, you could have billed nursing before expansion, just as an FYI. Like expansion is just an extension of billing and an addition of things for nursing. I think I've seen that question, or at least heard some of that feedback.
Okay, so like for the Pure Town hearing, which is part of the it's the MSP rate is $10.26. And then there is a percentage that's applied to that because that's 100% of the rate. But school districts typically, I don't know if it's 60-40 or what the exact is, but it's not exactly when the school gets reimbursed for their interim. There is a percentage taken off of that 1026.
Someone asked, I'm going to ask the same question someone else asked. Can you get consent through final forms or another registration software?
If you
I think
actually have, I guess, the platform, put that in there, you can do it electronically. I do know other school districts have included the parent consent as part of the registration process, as well as including it in their final forms. But I think that's all based on how you work it out with the vendor for final forms and how you can obtain that.
Yeah. So a couple of these, I think, where can I get the info required for general screening? Please just reach out directly to us, and we will be able to help you there. Someone said the information I have from the state said that pure tone test hearing test air required an IEP or school services plan of care. However, your list of nursing CPT codes says that an IEP is not required for hearing. Did that change?
Pritesh, can I share something? I'll share it with them right now.
Yep. Go ahead and share your screen.
I just pulled this up from the Ohio Department of Medicaid. This is their website. Here's Pure Tone. Right here.
Let me put it on. Okay,
oh,
here we
can
go.
you see?
You're gonna have to, yeah, yep, I can see it.
Okay. It says, is an IEP service care required? No. Then it does say here, I'm sorry. The order, it does not say that the RN needs it, but so that's that one. And then here, vision. It's 9-1. Can I go on that one? 9-1. Cheryl, what's the vision number? 9-1. And I don't know, again, I spoke with Department of Medicaid, we got clarification. I'm not sure if they updated this specific document, but they do update it. So if you still aren't convinced, please reach out to Department of Medicaid. It's
99173, someone said in the chat.
991. I just don't remember these. Here we go. Order no, IEP no.
Okay, it looks like there is a lot of concern from nurses about these. I don't know if they're called universal screenings or the state mandated screenings and having to document hundreds or 1,000 students. So I think this is kind of our stance. This is a conversation probably to have with your special ed director. And if your special ed director needs guidance, we can provide that guidance because like Tracy just said, there is a lot more going on here than just documenting 1,000 services that may or may not get you anywhere. So this is a conversation, it's a legitimate concern to bring up with your special ed director, and then have your special ed director reach out to HPC, and we can help muddle through that with them, and so that they can come to a good decision for your school district.
Yeah. And it looks like someone who had asked that question where there's conflicting information between us and ODM, there actually wasn't. They had just downloaded an older file. And so the document had changed since then. So I think we're all cleared up there.
But there is a question that says, if they don't have an IEP, why do the special ed directors be involved? So that's just by default what HPC, since the existence of the program, we have always worked with special ed because that's where it was only for students related to being ruled out if they had a disability or on a care plan. We've always worked directly with special ed, but we do understand it's branching out to pupil services, all service areas. So when we refer to special ed, it's just because that's always been our contact. It doesn't mean that we don't have additional individuals that we may work with in the school districts as well. So that's just what we're used to.
And in a lot of smaller districts,
Mhm.
special ed is taking this all expansion on. Your other go-to person, because these are our contacts, special ed and your treasurer.
Mhm.
Go to your treasurer, bring it, it's a legitimate concern to either of those two people, and we're happy to sit down and do a quick analysis with either or both of those people. Or if there's somebody else who should be brought into the conversation, we can also have a conversation with them.
All right. Last question. I know we're at 3:30.
Okay.
We have a team of RN screeners to do the routine mandated screenings. Is there any way of capturing those services?
I'm sorry, what was that?
We have a team of RN screeners to do the routine mandated screenings. Is there any way of capturing those services?
They have to be documented and then sent regardless of what platform, whether it's your billing vendor's platform or another documentation system for nursing. It has to be documented and then it can be captured. So if those RNs are just a team and they're come in PRN and they're contracted and then the school's paying for that service, yes, they can document for it as long as they're paying for it. Or if they're the employees, yes, they can be documenting for those services as well.
Yep. Okay. And then there's a lot of, have you thought about speaking with the issue on vision screens at the Ohio Nursing Convention and other conferences? We love to present at conferences. We love to do it in collaboration with the Department of Medicaid. They are the governing body in Ohio, and we like to follow their direction. Right. And so we will try to work with them to partner with them to present on those topics. So thank you for the suggestion. And it's always better, stronger being side by side with them. All right, very last question, I promise, and then we are done. If one nurse is doing the screens, can another nurse do the data entry, and do both of them have to be on the random moment time study?
So the reimbursement needs to be submitted by the person who provided the service, and it has to be submitted under that professional's name. So I guess every system's different. I don't know everybody's billing vendor or how they're documenting. If someone does it clerically or you do data entry, but in HPC, if I'm the nurse and I'm providing the service, I have to e-sign that I provided the service. I can only speak for how we would recommend that.
Yeah, that's how we would recommend it.
Mhm.
Okay. Thank you, everyone. I know
Thank you.
Tracy and Cheryl, thank you both for hanging in there for 30 minutes, and thanks everyone for their questions. If
Thank
you've
you very
got
much.
any questions, please reach out directly to us, and we're happy to help. And we will follow up with the links to the LEA webinar. And we'll continue to do this. And we've gotten really great turnout. So we really appreciate the engagement. I think over 250 folks joined today. So thank you so much. And I hope everyone has a great rest of the week.
Bye. Thanks.